Welcome everyone, I'm Dr. Taz, your integrative health expert, and all about living healthy naturally. Now if you've been watching the news the last few days, you may have caught whiff of the fact that there's a measles outbreak in Disneyland. And while we're all concerned about the outbreak, the news has gone crazy with everyone from President Obama and down to your pediatrician and your local moms debating the whole vaccine controversy. You know, it's very interesting to listen to the debate and to listen to what everybody has to say, but honestly, I'm still a bit concerned because what I haven't heard with all the different sides weighing in on whether we should vaccinate, we should not vaccinate, we should vaccinate all at one time, you know, what I still haven't heard is that we need to focus on the patient. We need to focus on the individual and really get a good sense of who the patient is and what their risk factors may be for tolerating a vaccine or for not really doing so great with the vaccine. And that's exactly what I see here in practice. We have patients that do fantastic with vaccines. They do well with the American Academy of Pediatrics recommended schedule. They get their shots, they go home, we never hear from them again, they do beautifully. But then we do have some patients where they have had a history of chronic medical problems. They've had GI systems that were not quite where they needed to be. They've been weaker children, maybe not gaining weight. They've been sick a lot. And for those kids, you know, it's a little bit challenging for them to handle the regular schedule of vaccines. So what are you supposed to do? I have children and I've been through this. I have a 5-year-old and a 7-year-old, and they both tolerated vaccines in a very different way. Well, here's where I stand, and here's what I think needs to be done about all the vaccine confusion. I do think we need to vaccinate. I am not anti-vaccine, I am pro-vaccine. However, I firmly believe in individualized schedules for patients. After they're evaluated, they're looked at, they're thought through critically, and then we develop the schedule that's appropriate for that particular child. You know, I was listening to the news this morning and I heard a pediatrician say something about the fact, well, we can't do that, it's too confusing, it's too complicated, we don't know when this child has had a vaccine and when we don't know when this one has. It's not that hard. We do it here in practice, and every child has a schedule that we have thought through, we've placed it in the system, and the parents know to come through at a specific time. So yes, let's vaccinate. Let's not have people walking around and bringing measles back and pertussis back. Those were public health epidemics a generation ago that affected our parents that we do not have to see today thanks to vaccines. But let's be a little bit more thoughtful about it, a little bit more precise about it, and again, take into account the individual rather than just thinking about the whole. And I think that will take the vaccine confusion away, and more importantly, it'll take the fear about vaccines away if we can at least begin to acknowledge that this is something to think about. Well, thank you for watching today. I hope I've been able to clear up maybe just a little bit of the vaccine confusion and controversy. Thanks for watching. I'm Dr. Taz, here with OldFashion Health today. Good health from the inside and out.